In the past, many aspects of human health, particularly women's health, were misunderstood, misdiagnosed, and often shaped by cultural assumptions rather than scientific understanding. One of the most notable examples of this is a condition historically known as female hysteria. For centuries, women who experienced symptoms such as anxiety, irritability, mood swings, insomnia, or emotional distress were frequently diagnosed with hysteria, rather than recognizing these as complex psychological or physiological conditions. Medical professionals of the time grouped them under a single, vague label. This diagnosis reflected more about the limitations and biases of the medical field than the actual experiences of the women themselves. To treat this so-called condition, physicians developed a range of methods. Among the most unusual and widely practiced was what was referred to as pelvic massage. This treatment involved manual stimulation performed by a doctor with the intention of relieving symptoms. The desired outcome of this procedure was something termed pelvic paroxysm, a clinical phrase that, in modern understanding, corresponds to orgasm. As surprising as it may seem today, this treatment became increasingly popular. Many women sought it out regularly, believing it helped alleviate their distress. However, the process was time-consuming and physically demanding for doctors, who found themselves performing the procedure repeatedly throughout their workdays. This growing demand led to the development of mechanical solutions to reduce the strain on physicians and increase efficiency. Early devices were created to replicate the motions involved in the treatment. These machines, some powered by steam and later by electricity, marked the beginning of what would eventually become the vibrator. Initially, these devices were used in clinical settings under the supervision of medical professionals. Over time, however, they began to make their way into private homes, particularly among wealthier women who could afford them. In these households, the devices were kept as a form of treatment to be used whenever symptoms of hysteria were believed to arise. As medical knowledge advanced and societal attitudes shifted, the concept of hysteria was gradually abandoned. The understanding of women's mental and emotional health became more nuanced, and the diagnosis itself fell out of favor. Alongside this change, the use and perception of vibrators also evolved. What began as a medical tool eventually took on a different cultural meaning. Today, vibrators are widely recognized as personal devices associated with sexual wellness and pleasure rather than clinical treatment. Their transformation reflects broader changes in how society understands the body, health, and sexuality. The history of the vibrator offers a fascinating glimpse into the intersection of medicine, culture, and technology. It reveals how medical practices can be influenced by social norms and how innovations can shift in meaning over time. Ultimately, this story serves as a reminder that what is considered scientific truth in one era may later be reinterpreted as understanding grows and perspectives change.